Let's talk about osteoporosis. Osteo means bone, porous means porous. Osteoporosis is a term that we use for weak bone. If we look who has weak bones, well, it's as we grow up, our bones are less strong. Overall, regarding hip and knee replacement, there's considerations we have to take when you have weaker bone. There are different parts we can use that give us better success in a person with weak bone. Now, prior to any surgery, and we didn't mention this in things we can change, but you can make your bone stronger prior to a hip or knee replacement surgery. There's medicines that doctors will prescribe. A lot of patients have heard of bisphosphonates, and there's no free lunch. They have some side effects that you must consider. Diet and nutrition plays a role in it. Hormonal changes plays a role in it. There is a study that shows if you hold 30 pounds for 30 seconds a day, you can increase your bone strength. If we look at those astronauts in the space station where they're floating around and there's no gravity, they lose bone mass because there's no gravity. The body has a system where if you're not using a resource, it'll give it to someone else or something else in the body. And so we have Wolff's Law that if you don't use the bone, you lose the bone. Astronauts, now that they know this, have a system up in space where they can keep their bone stronger by simulating gravity. And so you can use those weighted exercises to increase your bone strength. All of this leads to the surgeon making the decision before or in the operating room to bring in the parts that may be used for weaker bones, and almost all of us have those parts there for any scenario. It's a pretty routine thing.